I'll hand over the floor to Kabir, who will introduce us on what are the plans of HSG for the next 5 years, and then what he's expecting is suggestions from us on how that plan can be strengthened so that he can take it back to the board. Okay?
Thank you, Deva. Deva, why don't you join here? And I'd like to invite Bruno as well as one of the thematic working group leads. And we don't have Prashant yet, but I hope he can join when he's here. So thank you everyone for joining, and I believe there might be some people on Skype as well with questions. Really the objective of this session is to give a brief presentation of Health Systems Global's strategic plan for the next 5 years, and to get suggestions from people in response to 3 questions that I'll ask. So we've structured it so that we can sort of manage the responses. I know there's always a desire to ask us questions. I mean, I'm one of the members of the board, and I'm sure there'll be questions from the membership directed towards me, but maybe we could handle those over coffee tomorrow or over dinner. It's really, the idea is to get your thoughts and your inputs rather than mine. So I'll move ahead with the objectives. So it's to solicit feedback from HSG members and other stakeholders around key issues and questions to inform the final strategic plan, to provide an opportunity for discussion on the role of Health Systems Global so far and changes that can be implemented to further develop the society and ensure that its mission is realized, and ultimately to get views from stakeholders such as yourselves. Many of you may already know a little bit about Health Systems Global, but I'll quickly run through a set of our achievements over the last 4 years since inception. So as some of you will know, it was conceived during the first Global Symposium on Health Systems Research in 2010, and founded and launched officially at the second symposium in Beijing. And since then, we have successfully, it's taken over as the official organizing group for the Global Symposia, and it's successfully organized the third one in Cape Town. And we are now well underway with preparations for the fourth symposium. And those are some statistics about our membership, and it's slightly misleading, 1,600 members, because members tend to rotate every 2 years, but we have a much wider group of people who are consistently engaged with us through social media and as ex-members and as people who are generally interested in and part of thematic working groups that we run. We've also transitioned to a full-time secretariat based in Switzerland from Copenhagen. So the main way in which Health Systems Global operates in between the symposium is through various activities of its thematic working groups. And I won't go through these in detail, but these are the 10 thematic working groups we have currently. As you'll see, some of these deal with specific topic areas such as medicines or community health workers or the private sector, whereas others are more focused on cross-cutting areas such as translating evidence into action, or on methodology, or on ethics, or on teaching and learning. And everybody is invited to join thematic working groups, regardless of whether you're a paid member of HSG or not. I'll skip this slide. It's just a little bit about context and how the move from the MDGs to the SDGs offers a more holistic approach, and helps us think a little bit more systemically about global health issues and move ahead. But just to maybe mention here that we do have a consistent focus on implementation science and the importance of embedding research within policy and practice, and also on strengthening the link between health systems research and a broad focus on health equity. And I think that's something that's been very amply demonstrated in this particular conference. So I'm really glad that HSG, in a sense, has found a place in this excellent conference as well. So quick presentation of our strategic plan. We have, it's a 5-year plan, and we have 4 strategic objectives and 11 actions, which I'll spell out in the next few slides. Our mission is, in a slightly long sentence, to connect and engage researchers, different constituencies, along with researchers, policymakers, managers, educators, and other constituencies, to advance the field of health systems research and to create opportunities to unleash their collective capacity. We've also, in this particular strategic plan, spelled out a series of values, and I think many of those will be close to a lot of what you do and what you practice, and we thought it was important to identify those as clear values that HSG espouses. Moving on to our first strategic objective is on community building, and really that's where we focus on our thematic working groups and on building the community of health systems research, but not just researchers, but encompassing practitioners, policymakers, and civil society and funders as well. The idea is really to grow the community, and that's, as a membership organization, one of the primary objectives of the strategy. The other important objective is to advance the field of health policy and systems research through development of research methods and also through developing the skills and competencies of HSG members. Here we have something of an overlap with the agenda of the Alliance for Health Policy and Systems Research, I'd also like to let you know that we have a memorandum of understanding with the Alliance, and there are certain areas on which we've decided to collaborate and certain other areas where we've decided to distinguish our roles. And the latter two here, disseminating research methods and promoting capacity building, are areas where we will be working in coordination with the Alliance. It's a pity that the members of the Alliance who are present here had to leave just shortly before this meeting, otherwise it would have been excellent to have them as well. So I'd also like to highlight the use of the word equitable in the second bullet point. It's really important for us to not just disseminate knowledge, but to actually think about differential access and how not everybody has the same sort of access to knowledge resources on health systems, and to try and bridge that those inequities. At the same time as undertaking these core activities, it's also important to serve as an advocate for health systems research, and that's a major objective of the society as well. As many of you will know, if you're researchers in the field or work generally in health systems, we struggle for funding. And that's because, in my opinion, a lot of donors, I think funders, are coming around to the importance of health systems research, but they're not yet convinced about its the credibility of the methodology that is used by health systems researchers. So as researchers, maybe it's up to us to also find ways of showing the value of the methodologies that we use. Prashant, why don't you join us up on the stage? Prashant is one of the conveners of the thematic working group, also known as Emerging Voices for Global Health. And finally, of course, important for any organization is to ensure sustainability, which reflects not only on financial sustainability, but also on our stability with regards to the membership base, and also the way in which we engage different constituencies and ensure a sort of a spread of interests across research, civil society, and advocacy, and policymakers. And this, in this symposium, upcoming symposium in November, we have put a special effort to ensuring that more policymakers will be present and give up some of their valuable time to be present and engage with us over a period of time there. So this is just a map of how we might go about creating value, and I think I just draw your attention to the 4 points over here rather than going into this complicated map. These are what we see as some unique propositions or unique strengths of Health Systems Global. We're a very diverse and large community spread out across almost 100 countries. We have an excellent communications management team working with our secretariat, and we rely a lot on information technology, although that's not the only way we would like to communicate our messages, which is why we face-to-face interactions such as these are very important. And we also have emerged, we feel, as a credible platform for many people to come together and talk about critical health systems issues globally. So this session is really focused on our need to get some responses from you, and you may not have actually read the entire strategy, but I think you've got a flavor of our broad objectives by now. So we have 3 questions, which I will try and simplify and abbreviate slightly. But the idea really is to welcome questions, responses to these questions. So the first one is, how can Health Systems Global be an attractive home and an effective voice for a diverse membership of policymakers, researchers, NGOs, media, and funders? What can we do to bring these groups together? Second, what are the key issues that we should be advocating on? Should we be an advocacy organization, or should we be enabling a number of voices to assert themselves in different ways? And finally, how can we grow our membership in geographic regions and among stakeholders where our membership base is currently smaller? I'm happy to say that India is not one of our smaller membership bases, although if you go per capita, it's probably quite a low coverage, but by sheer volume, we have a very strong Indian base. But certainly in the sense of how we can increase the presence and participation of different stakeholders, it would be excellent to get some of your thoughts. So I'm going to go back to that slide just to leave that open for you to refresh your memory. But just before that, I'm also pointing to the online consultations, which will take place. And now the dates have been announced. They're the 19th to the 21st of July. There'll be an online platform which has been set up, and everybody is invited to send in their comments online. There is a link available on the Health Systems Global website for you to access that. And you can also send in emails. Thank you. And we hope we'll see many of you in Vancouver or next time in Bangalore. Thanks.